There's no way to prevent allergies. However, there are ways to prevent the symptoms from occurring. The best way to prevent allergy symptoms is to avoid the allergens that trigger them. Avoidance is the most effective way to prevent food allergy symptoms. An elimination diet can help you determine the cause of your allergies so you know how to avoid them. To help you avoid food allergens, thoroughly read food labels and ask questions while dining out. Preventing seasonal, contact, and other allergies comes down to knowing where the allergens are located and how to avoid them. If you're allergic to dust, for example, you can help reduce symptoms by installing proper air filters in your home, getting your air ducts professionally cleaned, and dusting your home regularly. Proper allergy testing can help you pinpoint your exact triggers, which makes them easier to avoid. Complications of allergies. While you may think of allergies as those pesky sniffles and sneezes that come around every new season, some of these allergic reactions can actually be life-threatening. Anaphylaxis, for example, is a serious reaction to the exposure of allergens. Most people associate anaphylaxis with food, but any allergen can cause telltale signs: suddenly narrowed airways, increased heart rate, and possible swelling of the tongue and mouth. Asthma and allergies. Asthma is a common respiratory condition. It makes breathing more difficult and can narrow the air passageways in your lungs. Asthma is closely related to allergies. Indeed, allergies can make existing asthma worse. It can also trigger asthma in a person who's never had the condition. When these conditions occur together, it's a condition called allergy-induced asthma or allergic asthma. Allergic asthma affects about 60% of people who have asthma in the United States, according to the Allergy and Asthma Foundation of America. Many people with allergies may develop asthma. Here's how to recognize if it happens to you. Allergies versus cold. Runny nose, sneezing, and coughing are common symptoms of allergies. They also happen to be common symptoms of a cold and a sinus infection. Indeed, deciphering between the sometimes generic symptoms can be difficult. However, additional signs and symptoms of the conditions may help you distinguish between the three. For example, allergies can cause rashes on your skin and itchy eyes. The common cold can lead to body aches and even fever. A sinus infection typically produces a thick, yellow discharge from your nose. Allergies can impact your immune system for prolonged periods of time. When the immune system is compromised, it makes you more likely to pick up viruses you come into contact with. This includes the virus that causes the common cold. In turn, having allergies actually increases your risk of having more colds. Identify the differences between the two common conditions with this helpful chart. Allergy cough. Hay fever can produce symptoms that include sneezing, coughing, and a persistent, stubborn cough. It's the result of your body's overreaction to allergens. It isn't contagious, but it can be miserable. Unlike a chronic cough, a cough caused by allergies and hay fever is temporary. You may only experience the symptoms of this seasonal allergy during specific times of the year when plants are first blooming. Additionally, seasonal allergies can trigger asthma, and asthma can cause coughing. When a person with common seasonal allergies is exposed to an allergen, tightening airways can lead to a cough. Allergies and bronchitis. Viruses or bacteria can cause bronchitis, or it can be the result of allergies. The first type, acute bronchitis, typically ends after several days or weeks. Chronic bronchitis, however, can linger for months, possibly longer. It may also return frequently. Exposure to common allergens is the most common cause of chronic bronchitis. These allergens include cigarette smoke, air pollution, dust, pollen, and chemical fumes. Unlike seasonal allergies, many of these allergens linger in environments like houses or offices. That can make chronic bronchitis more persistent and more likely to return. A cough is the only common symptom between chronic and acute bronchitis. Learn the other symptoms of bronchitis so you can understand more clearly what you may have. Allergies are common and don't have life-threatening consequences for most people. People who are at risk of anaphylaxis can learn how to manage their allergies and what to do in an emergency situation. Most allergies are manageable with avoidance, medications, and lifestyle changes. Working with your doctor or allergist can help reduce any major complications and make life more enjoyable. Thank you for watching. Press the like button and subscribe for more health content.